Welcome to the Neuropathy Seminar. I'm your host, Dr. Ben Sweeney. So we're going to jump right into this. This is for anybody that has neuropathy, peripheral neuropathy, or if you don't know if you have it and you just have pain or numbness in your feet or tingling or burning or cramping, the Charlie horses, the hot or cold feet, or even starting to have like balance problems. If you've been diagnosed with neuropathy, or if you're curious as to whether or not you have it, get a pad, get a pencil, get a pen, and take a lot of notes, get some coffee, because I'm going to go through not only what neuropathy is, but exactly how you can stop it, and in most cases, even reverse it if it isn't too far gone. And then stay tuned to the very end because I'm going to have a very special offers for those of you that stick through the webinar. I'm going to have a very special gift and a special offer for you guys. So let's get into this. So the initial reason that I started doing this years ago, we've been doing neuropathy now for the better part of 8 years, 9 years really, and I think we've got the best protocol and the best systems and really the best treatment protocol that's available for peripheral neuropathy. But it was my stepfather. That's the guy on the left-hand side of the screen, not the right. But we call him Pop. His name is Dennis, and he is just a sweetheart of a man. Treats my mom like absolute gold, and he is in his earlier years, he was very athletic. His basketball jersey is retired at both his college and his high school, and played golf and tennis, and he was really kind of a stud from an athletic perspective. But now he struggles really badly with neuropathy, and you can see in that picture around his right leg, he's got that little band that goes around his calf. Well, there's a shank that goes down the back of his leg into his shoe that holds him up and keeps him steady. Now, since that picture, he has two of those, one on each leg, and he has to use a walker a lot of times if he's on really unstable surfaces. So I've been watching his health deteriorate, and it's just been horrible to watch. And he lives so far away, um, it'd be impossible for him to really get to my office consistently to do what it takes to turn this around. We're in Franklin, Tennessee, so it's a really long drive to get here. But in any case, we were at home for Christmas this past year, and at the time I had a 4-year-old son and an 18-year-old daughter. So keep me in your prayers, please, because it's a lot. So we're doing diapers and dating at one point in my house. So it's and same wife too, by the way, in case you're curious. But anyway, so we're at home for Christmas, and 3 hours away, and my son, who was 4 at the time, he's running around the house, and he's jumping off the furniture, and he's just kind of terrorizing, being wild. He's being a boy. And I remember my stepfather was watching him, and he was looking down, and Pop was kind of following him, and he wanted to play with him, and you could almost see like the thought bubble over his head. He was, like, I want to play with him, but how am I going to get back up? And it was heartbreaking. I remember just kind of almost tearing up watching that because he wants to play and engage and be part of his life because he doesn't get to see him often, but he can't, and largely because of his neuropathy. Well, exactly because of his neuropathy. So if we can't help him, then maybe we can help the thousands of people around this area that, the Middle Tennessee area that struggle with that exact condition. So the one thing I always ask is to keep an open mind. So everything we're going to cover today, quite frankly, flies directly in the face of everything you've been told about neuropathy. What you can do about it, is there even a treatment or a solution option? But I'm here to tell you guys, uh, there is treatment, there is hope. I get to see miracles happen literally every day. We get to see people get their lives back and regain their function and get out of pain and keep their feet and keep their mobility. Not because we do anything magical. I'm going to explain exactly what we do for these folks and possibly even for you. But it's just applying the right principles of allowing the body to heal and repair itself. So also to know that everything we do is backed in the literature. So I've got research, we'll cover a little bit of that. We're not shooting from the hip. I am a clinician. I'm not a teacher or a professor. I literally do this in the trenches every day. So everything that we're talking about, we do it every day in my clinic in Franklin, literally every single day of the week. So to get kind of a show of who is on this webinar, because a lot of people will experience numbness, and some people will say it doesn't really feel numb, but it feels like I've got like a marshmallow underneath my foot, or it feels like my sock is balled up underneath my foot, but then I take my shoe off, and my sock looks fine. That's a description of what we would call numbness. And the other version of that is where it feels like someone's got like a rubber band kind of tied around their foot, or they've got tape on the bottom of their foot. I've heard this explained 1,000 different ways, but at any rate, that would be numbness. The other symptom could be numb or tingling, like the pins and needly, like the prickly feeling, or like back in the day when your foot would kind of fall asleep, you get that little pins and needly kind of feeling, or even like the sharp stabbing or the zingers. So those can all be symptoms of neuropathy. The other symptom we see a lot of is like burning pain. So a lot of people, when in their feet, especially at night, their feet will start to burn and they'll get really hot and they'll be kicking off the covers. And the flip side of the inverse of that is that you could also have really, really cold feet. So they can be hot 1 minute and cold the next minute. And those are just based on which nerves are damaged. And then hand pain, that could also be another symptom because with neuropathy, most often it starts in the feet, and then as it progresses, it kind of works its way up the leg, and then at some point around the time it gets around to your knees or your thighs, it'll start to affect the fingertips and then kind of work its way inward and upward. Back pain, that's like usually 80% of Americans raise their hand when we ask that one. I think it's 83% of Americans will have at least one debilitating case of back pain at some point in their life. So it's essentially everybody at some point. So in our office too, and that leads us to the next one, is just generalized joint pain. If you've got bad shoulders or hips or knees or ankles, if you're not dealing with neuropathy and you're on the webinar, or you do have neuropathy, but you also have like a bad shoulder or a bad knee, hip flexors or hips and ankles, elbows, we have a lot of other options in the office, from laser therapy, and we can utilize PRP, which is platelet-rich plasma. We can use stem cells and shockwave, and we have tons of different options. So if you're not a neuropathy person, but you're a bad shoulder type case or a knee case, then stay tuned because we're going to talk about solutions for some of that too. So the goals of today, I want you guys to understand the challenging truth of the standard of care, which is what most of you have already experienced. You've already been down the medical route, more than likely, where you've gone to your medical provider and they've given you the anti-inflammatories and the muscle relaxers and the pain medication, and maybe even gone to the physical therapist and done the PT, or maybe you've gone to the neurologist or even the neurosurgeon. And there's a lot of limitations to that system, and we're going to talk through some of that. I want you to understand what could actually be causing the pain, because for most folks, they'll go to the doctor and they'll get the diagnosis and then they'll get the little bag of pills, but they're never really told, how did I get here in the first place? And then some of the documented dangers of living with neuropathy and allowing it to keep progressing. And then some of the proven methods for creating lasting relief. I could give you a big bottle of Jack Daniels and you would get really good short-term relief. You'd probably feel great, but we know that's not a good long-term strategy. So I want to show you how to fix this, not just, manage or numb the symptoms. And then lastly, some of the simple steps you can take to getting on the road to feeling better again. And some of those you can start today. So if you take notes, pay attention, there's some things as soon as this webinar ends, you can start doing to actually get on the road to healing and feeling better again. In this culture, we're seeing, it says a concerning increase. We're seeing a catastrophic increase in literally every disease that you can name. If you name a disease now or today, it's worse today than it was 20, 30, certainly 40 or 50 years ago. And when you look at diabetes, the rates of diabetes have gone up. As you see the graph, it's like 1,200% over the last 60 plus years. So you remember when you were kids, like when you were a kid, the two kinds of diabetes, do you remember what they used to be called? So when I was a kid, they called it juvenile onset and adult onset diabetes. My sister actually has juvenile onset diabetes. Now, they had to quit doing that because so many kids were developing adult onset or type 2 diabetes. They had to start calling it type 1 and type 2 because so many children, so many young kids are now developing adult onset or type 2 diabetes. So not only are we getting sicker and sicker, but it's happening at younger and younger ages. And here's a bold, I would say this is a bold statement. Diabetes is type 2 diabetes, the adult onset, the one that comes on later in life that's due to lifestyle changes. Diabetes is 100% preventable, and it's 100% reversible to a point. Now, nothing's 100%, so let's say 99. It's 99% preventable, and it's 99% reversible up to a point, because there is a point at which the train is just, it's moving too fast and there's no way to stop it. So If you implement the right game plan, which a lot of that we're going to cover today, you can actually reverse it or never get it in the first place. So heart disease is still the #1 killer in the United States. It takes the lives of about 700,000 people every single year. So to think about that, 700,000 Americans are going to die this year from heart disease. Is that because they forgot to take their pills? No, no. They're going to take more pills than at any point in history. They're going to take pills for blood pressure and pills for cholesterol and water pills and Lasix and lisinopril and statin. They're going to take more pills than any time in history, and 700,000 of those people are still going to die. So here's one of the limitations of the healthcare system that you have to know. There's nothing about drugs or surgery that prevent you from needing drugs or surgery. You get that? Like there's nothing about a drug or a surgery that prevents you from needing the drug or the surgery in the first place. There's no prevention in that system. Now, drugs and surgery can be amazing. Like when my daughter blew out her knee, well, I took her to the best surgeon in the planet. Like he did an amazing job, and she had a great result, great surgery. And my sister, who's a type 1 diabetic, she's been on insulin since she was 4 years old. So there is a definite time and a place for drugs and for surgery. It's just they don't actually heal the problem. They don't keep us from needing it in the first place. And really in medicine, what they call preventative health care, so blood tests and mammograms and CT scans and MRIs and scan like that they call preventative health care is not really preventing the problem, because if I have a fire in my house, when do I want to know about it? Like now, right? But what do I still have in my house? Yeah, I still got a fire. So early detection is not prevention. It's valuable, but it doesn't prevent the problem from happening in the first place. And true prevention is never getting sick in the first place. And then neuropathy. And especially since COVID, we've seen a massive uptick, just like a skyrocketing uptick in the number of cases of neuropathy. And there's some speculation that that's from the vaccine, and some people think it's from the virus or sitting around watching Netflix and gaining the quarantine 15. I think there's a lot of factors, but at any rate, it's gotten worse and worse over the last 6, 7 years. 1 second. All right. How much do you guys think that we spend? How much do you think we spend per year on healthcare? Now, some people say billions or hundreds of billions. The actual number is $4.5 trillion. So to put that in perspective, we spend $4.5 trillion on our healthcare. And that was from 2022, 2023. So obviously in the last few years, it's gotten, that much worse. That is literally 19% of our entire GDP. So 20% of every Starbucks coffee and 20% of every pair of tennis shoes and blue jeans goes toward our health and our sickness. And it's 7 times more than the national defense budget. So literally, we are spending an outrageous amount of money on our health care. And then one statistic is that we consume 75% of all the medications produced on planet Earth. Now, I think that statistic is a little old. I think it's actually closer to 63%. But, at any rate, we're consuming over half the medications produced on planet Earth in our little country, the United States of America. And then the question is, what percentage of the world's population are we? And most people say, we're 10% or 12%. We're 4. So to put that in perspective, we're 4% of the world's people, and we're taking 63 to 70% of the world's drugs. And I always ask this question when I'm in front of groups. I say, does anyone wish they could take more medications? Like, does anyone really honestly think that they're like one prescription pill away from being healthy? Or if I could just get one more? No, because we know inherently the less medications you need, the healthier you are. So if you look at the statistics, we take an average for seniors, people over 65, we're taking 18 new prescriptions per person per year. And about 20% of our seniors are on 10 or more prescriptions every single day. So that's an enormous amount of pills. I had a lady that, she was on 14 different medications every single day. She would get up in the morning and start taking her pills, and literally 14 prescriptions, not her vitamins and not her, Advil, but these are prescription medications. She would take 14 of those every single day. how can you know what's happening to that patient's body when you're giving them 14 different pharmaceutical drugs? Like, there's no way to know what that's doing to their liver, their gallbladder, their kidneys, or how they interact with each other. It's just essentially guessing, and in my opinion, it's malpractice. So most of you have heard of the opioid crisis. That's one that's literally devastated my family. So 8 years ago, January 8 years ago, was the anniversary, was when my biological mother died of an opioid overdose. And April, uh, 4 years ago, this April, was when my little brother died of an opioid overdose. Um, and he was, a story that you've heard 1,000 times, similar stories where he was working construction and he was up on a big tall scaffolding and he fell and he broke his leg and shattered the bones in his leg. So they put the pins in the screws, and I think they gave him 60 Percocet or some sort of oxycodone, 60 of those medications with 3 refills. So by the time he was done with the prescription, he was fully addicted. So of course he turns to you know, he turns to the streets and ends up getting heroin, and then heroin turns into fentanyl, and dies of an overdose. So for me, and by the way, too, opioids are one of the medications that they'll use to treat really severe pain with neuropathy. It's less so now, but they still use it. So if we can help people from going down that road of opioid medication, because it only takes 7 days of continual use of an opioid pill to trigger dependency. And most people think you got to be on it for months and months. I mean, you can go have your knee replaced or have a oral surgery and get a 10-day prescription, and in the right person with the right, you know, chemistry, it can trigger addiction in that particular case. So that's really part of our mission, is to keep people from going down that path and actually heal naturally and not get trapped in the shackles of addiction. So it's interesting, guys, that we've got the most doctors, and I would argue we have the best doctors in Middle Tennessee. We've got Vanderbilt, St. Thomas, like we've got the best of the best, and we've got the most in the best hospitals, and we spend the most money by a mile. So the question is, where do we rank compared to other countries when it comes to our health? And if you look at the list of the top healthiest nations, we rank number 69. So if you look on that chart, number 69. So it looks like we're beating like Algeria and Mexico, but we're losing to like Jamaica, Albania, Turkey, Latvia. You might know where Latvia. I had to look it up. It's in the Balkans, but Latvia, really? Like, we're losing to some of these third world nations when it comes to our overall health. And we spend the most money. We've got the best drugs and the best doctors and the lasers and the robotics and the AI technology, but yet we're still basically the sickest industrialized country per capita on the planet. And too, like, our infant mortality rate is about the same as Cuba. Per capita, we have the same infant mortality rate as a third world Cuban nation, essentially. That means that those are babies that don't make it to their first birthday. Those are not old people taking too many medications or smoking cigarettes. Those are babies that don't make their first birthday. So we've got to really understand that, like, this problem is across the board. It's top to bottom, and I've got the solution to the healthcare crisis. I've been working on this for 20 years now. I think I've got the solution. I figured it out. It took a lot of time, but I know how to fix the healthcare crisis. Um, we need more people, less sick. Yep, right. I know it's riveting. Like, we just need more people healthier. We need more people on less medications. We need more people so healthy that they don't have to go to nursing homes and they don't have to have unnecessary surgeries. We have them healthier from the inside out so that they never get sick in the first place. And again, that's the mission of our office. So the question is, what's causing all this? Like, why is it the way it is? Is it processed food? Is it seed oils? Is it, EMFs and um, what's the underlying problem? So I think a big piece of the problem, I was going to say chemtrails earlier, but what's the actual cause? I think a big part of this is we have too many washing machines in our life. So we have the one that washes the clothes, and then we've got the one that washes the brain, and we call those the idiot boxes. Those are on the in every room of our house. We've got a television. Now we carry a television around, literally in our hand. We carry a TV around with us everywhere we go, and we're constantly being fed messaging that says your problem is genetic. It's out of your control. You just need to take this pill. Take this pill. Ask your doctor if this pill is right for you. And most of that comes down to the advertising. Because here's a challenge. I want you to watch the evening news and you're looking out for those drug commercials. You know the drug commercials where the first, 30 seconds they're having like a picnic on the beach and they're throwing their frisbee and they're playing with their dog. And then what's the last 20 seconds of the commercial? It's like all the side effects, the hot flashes and rectal bleeding and early death and constipation, diarrhea. I remember I saw one on TV the other day. It was a drug for women's hot flashes, and one of the side effects was hot flashes. And I was like, how stupid do they think we are? Like, we're going to take a drug that clearly says it can cause the thing that I'm trying to prevent. But in two guys, there's no such thing as a side effect. That is a marketing tactic. Because if I take let's say I take a 400 milligram gabapentin, and you take the same exact 400 milligram gabapentin, same pill, but it gives you relief and it gives me no relief and causes me insomnia, what's the difference? I mean, we took the same exact pill. The difference is the person's individual chemistry. So their individual body type and chemistry determines how they react to the medication. If the medication does things that we like, we call those the benefits. If it does things we don't like, we call those the side effects. But here's the challenge. Tonight, watch the evening news, ABC, NBC, CBS, it doesn't matter. But just take a little notebook and count how many drug advertisements, how many drug commercials are in between the news segments. And any guess what percentage of commercials are for drugs during the news segments? It's about 72%. So 72% of all the advertising between the news segments is for pharmaceutical drugs. Why do you think they buy up all that advertising just during the news, specifically during the news? Why do they buy up all that advertising during the news? And I used to think it was because, older people are watching the news. That's their target market. So, ask your doctor if Ozempic is right for you, right? Or maybe because they want to create some brand awareness and they want to, make it, more appealing. The drug seems like it's more of a family friend, like it's more well known. That's not the reason. The real reason that they put all that advertising on the news, specifically the news, is because if they're the main advertiser for ABC and CBS and NBC and Fox and CNN, what's the likelihood that they're going to run a negative story about that drug company? So they get to control the narrative, they get to control the messaging by basically buying up all the advertising dollars. And CNN just recently signed an exclusivity deal with Pfizer to be their main advertiser. So the whatever news station you're watching, I've got my opinions on which are better and worse, but they're all bought, they're all sold, they're all getting corporate money and pharmaceutical intervention. Like it's all the same thing. So, and by the way, too, we're the only country on planet Earth that allows drug ads on television. Like other than New Zealand, which is very, very restrictive, but the US is the only country on planet Earth that allows drug ads on television. If you go to Spain or Germany or France or anywhere else on the planet, they don't have drug ads on television. It's only in the US because it's all about the money. All right. So, and that's all social conditioning. So the most common culprits when it comes to neuropathy is a drug called gabapentin, or also known as Neurontin. So it's kind of the same thing, gabapentin, Neurontin. Um, those are the first line because they're trying to get away from using opioids or prescription pain medications. So now everybody and their sister is now on gabapentin. And what you need to know about that medication, it's an anti-seizure drug. So it's an anticholinergic. It basically works to slow down your brain so you can't feel your feet. It slows down your brain so you can't feel your pain. That's essentially how it works. And the scariest part of that is it doesn't slow down, much less stop the progression. So the whole time you're dulling your brain to make your feet feel better, guess what the problem is getting? Right, it's getting worse day by day, hour by hour. And there was a recent study that was released in February of this year that found if you're on gabapentin, you got to pay attention. If you're on this, you need to know this study. If you're on gabapentin every day for 6 months, so you have a 6-month prescription, your risk of Alzheimer's and dementia goes up 29%, and your risk of mild cognitive impairment goes up 81%. That's just being on it for 6 months. If you're on that script for 12 months, your risk of dementia goes up over 40%. So it's literally destroying people's brains. I had a lady that was on 3,200 milligrams every single day. She was on 8 of those 400 milligram horse pills. Every single day she was on that dose. And when she came in for her consultation, she literally was so dopey, like I couldn't carry on a conversation with her. Like she was basically out of it. But her feet felt better, but what's her quality of life, right? So that's one drug they'll give is the Neurontin. The other drug they'll give now is a drug called Lyrica. That's a scheduled drug, so they typically start you with the gabapentin and then they graduate you up to Lyrica, which is also an anti-seizure medication that slows down your brain so you can't feel your feet, and it doesn't slow down or stop the progression. And guys, those are the two tools in the toolbox. And that's whether you go to your primary care doc, go to the Vanderbilt, go to the walk-in clinic, go to the best neurologist at Vandy, or you go to the Mayo Clinic. That's the treatment that you're getting. It's gabapentin and essentially Lyrica, or now they'll use antidepressants, and then in some cases they'll use opioids. But that's it, guys. Like no wonder that condition is deemed to be so hopeless because those are the only tools in the toolbox. Like no wonder people feel hopeless. But I'm here to tell you there's far more we can do, and I'm going to get right to that. So if you saw the check engine light in your car, most people would not put like duct tape over the check engine light. You realize the check engine light or the oil light in the car is your car's way of communicating with you that there's a problem, something's wrong, something needs attention. That's what pain is. So if you have numbness or tingling or burning or sharp stabbing pain or cramping, the pain is not the problem. The pain is your body's way of telling you that there's a problem. So it's just the symptom. It's just the check engine light in the car. That's all it is. You don't take the batteries out of your smoke detector when it goes off. You go try to figure out where the fire is. Same thing. We wouldn't take a hammer and bash out the oil light. But that's what taking medications and drugs essentially does. It's just covering up. It's just masking the symptoms, while in essence the problem continues to keep getting worse. So peripheral neuropathy, the neuropathy, the definition for dummies, it's damage to or disease affecting nerves, and it can be associated with your toes, your feet, your legs, your arms, your hands, back. I had a lady years ago that it had got up both of her arms, both of her legs, it had gotten up her back, and it was actually getting up into her neck. Like it's peripheral, so it starts in the periphery, in the hands and the feet, and then it kind of works its way inward and then upward as it continues to get worse. So it's about 9% of the US population, or about 30% of people over the age of 65. So it's a huge swath. And if we look at the spectrum between, very, very mild early onset to advanced, it's well over 30% of people are on that spectrum. It's most common in older adults, although I did have a kid that he was a sophomore at Belmont, and he was our youngest ever graduate. He was 22 years old. He graduated our peripheral neuropathy program. So now, sadly, we're starting to see it at younger and younger ages. And only 30% of the diagnoses are linked to diabetes. Years ago, a decade ago, when we first started getting into this, I thought neuropathy was just a diabetic problem. I didn't think you could really get neuropathy unless you had diabetes. Like I thought that the two just kind of went hand in hand. But it's only about 30%, and we're going to explain the other, 70% of how you get it. So the 7 most common warning signs, you have numbness, and again, that might feel like numbness, or it may feel, again, like somebody's got like a rubber band around your toes. Whoa, the camera's falling apart here. Sorry guys, a little technical difficulty there, but we're back. So yeah, one of the symptoms could be numbness, and again, that can feel like, their sock is bunched up underneath their foot, or they're standing on a marshmallow, or they've got tape on their foot or a rubber band around their toes. That's a common numbness type symptom that people feel. People also get burning pain, and again, it can go from hot feet to cold feet, so burning is common. Cramping, a lot of people get like the restless legs, or they get the calf cramps or the thigh cramps. Their feet and toes kind of draw up at night, so cramping is a symptom. sharp stabbing, electrical pain, prickling and tingling, balance problems and falls, and then issues with sleep. I would say those are the 7 most common. That's not an exhaustive list, but those are the most common ones that we see. And by the way, too, how many things you have on that list does not necessitate how good or bad the problem is. Because I had a guy that just had numbness. That was basically it. And he was one of the most complicated cases that we'd ever seen. Like, he just had numbness, but it took him like, I think it was like 6 or 8 weeks until he actually started to get some feeling back. And then I had another lady that had basically every single one of those on that list, and she was one of the easiest cases that we ever treated. I think by the end of week 2, she was like 80% asymptomatic. So, how many of those things you have on the list doesn't necessitate how good or bad the problem is. Again, the pain and the symptom is just the oil light. It's just the check engine. It's not the problem. It's just your body's way of telling you that the nerves are dying, basically. So the best way to visualize this, if you have like a household cord or like your cable wire coming out of your TV, that every cord, every nerve has an insulation on the outside of that nerve, and when the insulation or the myelin sheath begins to break down, it exposes that nerve on the inside. So it's like somebody took a piece of sandpaper and destroyed the lining, or a rat chewed the exterior. So it's basically exposing the inner part of that nerve, and that's a good analogy of kind of how neuropathy works. So some of the causes are diabetes or prediabetes. Those are obviously causes. Again, that's 30% is related to diabetes. Or you could have pre-diabetes, which is metabolic dysfunction or mitochondrial dysfunction. It's estimated that 93% of American adults have poor functioning metabolisms. Only 7% of Americans have a healthy metabolism in the U.S. Excuse me. Poor circulation, particularly the microcirculation, like those little bitty blood vessels that innervate the nerves, can become damaged. You can have toxic exposures to like chemotherapy, or if you grew up on a farm that was sprayed with a lot of pesticides, or you worked in a plant that had like a lot of industrial chemical exposure. Back and neck issues, because the nerves in your neck travel to your arms and your hands, and the nerves in your lower back travel all the way down to your feet. So sometimes there's an upstream component that we have to pay attention to. Surgeries, autoimmune diseases, infections, alcohol abuse, liver, kidney, thyroid conditions, especially with women. We always have to ask them or go through a thyroid history with them, because a lot of their neuropathy or cold hands, cold feet, tingling, burning can actually be coming from the thyroid condition. And then sometimes just being on a lot of medications. Like if you go to the CVS and you get your bag of prescriptions, you know how you get that bag and it's got like the little booklet stapled to it? You know, the booklet that we just tear off and throw away and nobody ever reads. Like if you actually read that booklet of the side effects, some of the side effects of some of the medications that we're on are actually neuropathy. Like blood pressure medicine can cause a B12 deficiency, which can lead to some of the symptoms of. So I would implore you, if you're going to take the medication, read the booklet, read the side effects, at least know what's going into the body if we're going to take it. So some of the science, so again, if we took that wire, like that little wire, the one that we showed you on the previous slide or two, if we open that up, there's 7 different nerve fibers that we have to test. So there's the large, the A alpha, the gamma, beta, B and C fibers, and they all have different jobs. So every one of those little bitty nerve fibers has a different job to serve in the body. So when people come in, we have to test each individual nerve fiber to see, A, is it functioning, is it healthy, and B, if it's not, what do we have to do to get it back online? So these large A alpha fibers, those are the ones that control a thing called proprioception. So if you're to stand on one foot and close your eyes and touch your nose and kind of lean back, those fibers are the ones in your feet that are communicating to your brain to tell you where you're at in space, your position in space. So falls put seniors at risk, obviously. About 1 out of 3 adults over 65 falls every year. 20 to 30% of those are considered moderate to severe. 10% of falls are fatal. And that doesn't mean that they died on impact. Have you ever heard broke your hip, died of pneumonia? You guys have heard of that, right? So it doesn't mean that they died on impact. It just means that they broke their hip, so now they're horizontal in a hospital bed. and the fluid accumulates in their lungs, which becomes infected, and then that leads to, their demise. So falls are a big deal. Like, it's not just that you're embarrassed because you fell down at Walmart. Like, it could be the end of someone's life if it's bad enough. And it's the leading cause of injury death in people over the age of 65. And I don't know about you guys, but I don't want to lose my mobility. I want to be able to walk and get around and get off of a chair and off the toilet by myself. Like, I always kind of jokingly but not jokingly say, I want to die young. I want to die young as late as possible. That's my goal. I want to live long and then die like super quick when the Lord calls me home. Live long and just die quick. But sadly, that's not how most people do it. Most people in America, they spend that marginal decade on hospice or in some sort of a facility where they lose their mind, they forget their relatives, they can't move around, they lose their mobility, and it's just a kind of a slow demise, not the way our great grandparents used to go out. And again, those things are preventable, but the earlier we get on these things, the better. These smaller fibers, the gamma, the B and C fibers, when they become damaged, it can lead to amputations. 86,000 of those happens every year, and then obviously people lose their mobility. I don't like this slide, really. It kind of gives me the heebie-jeebies because A, she's smiling, which is kind of ironic, and it kind of feels like a scare tactic. Like, I'm showing you a slide of someone whose foot or leg is amputated. But the reality is, who do we never think that's going to happen to? Like me. Like, that's not going to happen to me. That's somebody else. Until it does, and then it's too late. I had a guy, like, right years and years ago, when we first started doing this. His name was Craig. When he came in, he had already lost his big toe. So his big toe had already been amputated. So clearly the goal for him was not to reverse his neuropathy. The goal was to keep the rest of his toes. And to my knowledge, he still has all of his feet. He checked in several years after he graduated. He's still doing good. So um, we can get this problem under control, but we have to get it early enough. Now, this is a dinner. So there's a dinner seminar. This was a friend of mine that did this dinner seminar. He was doing a neuropathy seminar. So he rented out a dinner space and he brought people in, invited them in to come get a free dinner and then learn about peripheral neuropathy. And a lady that was coming to the dinner, she was parking her car and she hit the gas pedal when she meant to hit the brake, and she ran her car into the restaurant that she was going to learn about neuropathy, which nobody was injured. It was kind of, comical a little bit. But what do you think happened to her driver's license? Yeah, it's gone, right? She can't drive anymore, so she's got to be, driven to church, driven to see her grandkids, driven, like, she's got to be cared for instead of being able to care for other people. So again, I don't want to lose my mobility. I want to keep moving and stay on my feet, but the nerves in your feet have to be healthy. They have to stay healthy, and you have to keep blood flow there in order for that to be a reality. So what are the choices? You can do nothing. That's an option. But any chronic degenerative condition we do nothing about is going to get what? Worse, right? You can go to the primary care doc and get drugs to basically mask or cover up the symptoms, or you can get referred to a neurologist. Now, if you've been to a neurologist, the typical neurology appointment, they're going to do what's called a nerve conduction study or a needle EMG, where they take that needle and they stick it in the nerves kind of up and down the legs, and that machine makes that screeching noise. And here's the thing. Remember how many nerve fibers there are? There's 7. That tests the function of 2 of those 7 nerve fibers. So you're not even getting a clear scope of the picture, and it's, for a lot of cases, it's terribly painful. And guess what the prescription is when you leave getting your confirmed diagnosis of neuropathy? Right, it's gabapentin. It's like the same thing. You're told the same thing that you already knew, because it probably took you 6 months to get into the neurologist. By the time you got there, you've already been to your medical doctor a half a dozen times for this. Like, you already knew what you had. And the question is, why do they do that? And it's because anytime I ask the why question, you just kind of do this with your hands, right? Like, it's a moneymaker. So, because it doesn't give us any valuable information. I had a guy that went to the Mayo Clinic. He spent 5 days in the Mayo Clinic, and at the end of his Mayo Clinic trip, they diagnosed him with neuropathy, and guess what he left with? Yeah, gabapentin, right. So it doesn't really matter where you go, guys. It's almost the same exact treatment philosophy and treatment option regardless of where you go. So most people have been told there's nothing you can do about it. You're going to have to just learn to live with it, or you're going to have to just get a cane or get a walker, or maybe get a one-story house so you don't have to go up and down stairs, or get a ramp going into your front porch so that you don't have to climb those stairs, right? So change your external environment to manage what's happening to your internal environment. And I'm here to tell you guys, again, I get to see people every single day get their life back. They regain their mobility, they get off the medications, they improve their function, they get out of pain because they got to the root cause of the problem. So again, living with it leads to surgeries, walkers, wheelchairs, all the scary stuff. We know that. And then doing the same thing over and over and expecting different results, guess what that's the definition of? Insanity, right? And that's Einstein's quote. But in some ways we kind of keep doing, like, if I just maybe go to this doctor, or maybe add this medication, or maybe take 2 of the pills instead of just 1 of the pills. But that's essentially just doing the same thing over and over, expecting different results. So here's the good news. I just spent the first 20 or so, 30 minutes or so, just depressing you. So I'm going to get to the good news. The peripheral nerves have the ability to regenerate as long as the underlying nerve cell isn't dead. Once that nerve cell is dead, it's dead. Other than the good Lord coming down to revive your nerves, once that nerve cell is dead, it's gone. But if there's still life in the nerve can heal. So here's the best way to visualize this. If you look at the top picture, that's a healthy nerve with good blood supply, no symptoms, everything feels normal. When you get to that second nerve, that's called the moderate stage of degeneration. So in that stage, we start to lose some of the blood supply and the nerve begins to deteriorate. And that's where you have like the pain and the numbness, the tingling, the burning, the cramping, the cold feet, restless leg. That's where some of like the balance issues typically begin, is in that phase. When you get to the third phase, that's where we start to see like canes and walkers and wheelchairs and really, really bad mobility issues. And then lastly is amputation. Now, the scariest thing is it can take decades to go from that first one to the second one, but to go from second, third to fourth, sometimes that can be a pretty steep slope. It can be quick. Obviously, the best time to get a hold of it is, as early as possible. And what we do in our office works really, really good from here up, from that second stage up. In those later stages, what we do in the office is very, very ineffective, or it can maybe only slow it down or stop it. It's not going to reverse it in those stages. So here's the secret sauce. This is kind of why what we do works. And we call it the 4 R's. It's the 4 R's to recovery. The first thing we have to do is we have to rejuvenate by increasing blood flow, and then we have to regenerate the nerves, and then we have to rehab through certain kinds of therapy, which we'll discuss, and then we have to reduce inflammation. So that's it, guys. You want to know how we get people well? It's that 4-step process right there. It's about nerves, blood flow, rehabilitation, and reducing inflammation. And the biggest trigger of inflammation for most people is a thing called sugar. We consume way too much sugar. Sugar is highly inflammatory. And then when you add in the bread, pasta, cereal, crackers, chips, pretzels, cookies, bagels, muffins, pastries, tortilla chips, rice, oatmeal, you start adding all that up, it's just too many consumption of carbohydrates. So what we try to get people to do during the program is to eat more like protein, veggies, and fruit. So protein is beef, chicken, lamb, eggs, fish, turkey, a little bit of pork. Protein, veggies and fruit, nuts and seeds, berries and beans, herbs and spices, omega-3s. So that's the nursery rhyme protocol. So just try to eat more real food, right? Like real food that God put on the planet to heal and nourish our bodies, and less of the packaged, processed, garbage junk food that we typically mostly eat. And then we recommend you eat the 80-20 rule. So do 80% healthy and 20% Southern. Right? So that's a joke. 80% healthy, and then 20% you kind of let the wheels fall off and have birthday cake and celebrate with the boys or whatever. So how do we increase blood flow? We use a process called red light therapy. If you've ever heard of red light therapy, the ones we use, if you look at that red light, here it is on this side, It's got like a purple light and a red, purple, red, purple, red. The purple is near infrared, so it's on a wavelength of 850 nanometers, and then the red light is on 660 nanometers, and they penetrate at different depths to trigger your body to produce more blood vessels around the damaged area. And I initially thought that was the hokiest thing on the planet, that you're going to shine a red light on somebody's foot and it's actually going to help their neuropathy. But it actually does work. It's legit. Um, According to NASA, who invented it, it's developed. It speeds up cellular regeneration. It reduces pain. It increases blood flow, and it promotes new blood vessel growth. It's a process called angiogenesis. It's the creation of new blood vessels, and then it decreases healing time. And then for the nerve regeneration component, we use a machine called a Hockamed. And most people have never heard of that equipment. I think we're the only ones in Middle Tennessee that actually have one of those pieces of equipment. I know there's a guy in Johnson City, Tennessee that has one, but in terms of Middle Tennessee, I think we're it. But what happens is we put those little pads, the leads that come off that machine, we place it specifically where the nerves are damaged, and it runs through a cycle that tells your body to repair the nerve. So it's getting your body to do the healing, and it feels kind of like a TENS machine. Like if you ever use like a TENS unit, it feels kind of like a TENS machine. Although that TENS machine is like $100, and this thing is like 40,000. So it's completely different technology, but it feels kind of similar, but it's actually regenerating the nerves versus just like if you bumped your elbow and you rub it, it feels better. That's kind of how the TENS machine works. So there's the research of 2,000 different references for light and electrical therapy. So if you go to PubMed.gov and put in, light therapy and neuropathy or electrical therapy and neuropathy, you'll see an indexed list of indexed medical literature a mile long. So the question is like, why does my doctor not know about this? Like, if this works, how does he not know about it? Well, it's based on training, and I've talked to so many different medical doctors that are like, I can't stand neuropathy cases. They're lovely people, but every time they come in, they just kind of just give them more medication, and they just keep getting worse. And I'm like, well, doc, like we've got all these things that we can do to help these people. We've got like pulsed electromagnetic field therapy and laser therapy, and then we got Hockamed and shockwave, like vibration therapy and laser and sound wave. Like we have all these different options to help people heal themselves, but it's almost, and this is every case, it's always in one ear and out the other. It's like, I guess it's a hard pill to swallow that there's things out here that could be helping people that my office doesn't have, or that I don't know about. At any rate, I think it's a bit of cognitive dissonance, but there are things that can help people. We just have to figure out the right approach and what therapies, and then design a protocol specifically for you. So imagine for a moment that you're sleeping through the night peacefully. You're not kicking your spouse and ruining the covers. That you're walking with confidence, feeling steady on your feet again, taking trips, enjoying family outings, vacation, pickleball, playing golf, working in the yard, whatever floats your boat and whatever gives you life. And then feeling like you're 10 years younger. I would say that's one of the more common things that people say is when they graduate the program, their body feels younger. I feel like I'm, feel more energized. I've lost a little bit of weight. Like I've got more energy. My body, my shoulder doesn't hurt the way it used to, and we weren't even working on my shoulder. I hear that all the time as well, because we're getting your body healthier. We're not just treating your feet. That's the distinction between this and just taking a medication. Is we're trying to get you healthier from the inside out, and then the healing of the feet is a good side effect, quote unquote. So this is my personal story. I hate this slide. This is my wife when she was so sick. So like I said before, I've got a 19-year-old daughter. Right after we had our daughter, we got pregnant like back to back. And from the get-go, it was a terrible pregnancy. It was just in and out of the hospital trying to stop the preterm labor. And we ultimately ended up losing our daughter in the second half of that pregnancy. And then from that point on, for about 2.5 years, from losing our daughter for 2.5 years, she was essentially bedridden. She was diagnosed with a condition called POTS, and that stands for postural orthostatic tachycardia syndrome. So basically, every time she stood up out of a chair, her heart rate would go from like 60 beats a minute to like 160 beats a minute, just standing, basically. So it's like having POTS is like having chronic fatigue with fibromyalgia, with shortness of breath and heart palpitations and dizziness, and it's just 50 things rolled into one crappy package. It stands for postural orthostatic tachycardia syndrome, but it really stands for sucks. So that was us at Vanderbilt. We took her to Vandy, who's the experts in that condition, and they were great doctors, great staff, great everybody. But all they did was give us medications, which the first one didn't work, and then we came back. The second one made her worse, and then lastly we got an antidepressant. And the messaging that we got was, this is just in your head. And I watched her go from 160 or so pounds down to 97 pounds, literally in a matter of months. It's like my wife was dying. I'm at work helping people, and I can't even help my wife. And I remember during that time, like the despair, and I was mad at God, and it was hurting us financially, and it was I was trying to figure out how to cook dinner and organize the nanny, and got to get laundry, and then I got to go to work because I've got a busy practice that I've got to run. So just the chaos and the despair during that moment. Like when you lose your health, or when somebody around you loses their health, nothing else, your whole priority list gets inverted. It's like everything I thought that mattered. Like, do you think I cared about what shoes I was wearing when she was so sick, or what football game was on TV, or vacation? Like, no. What's the only thing we cared about? And that was her health. And it's said that a healthy man has 1,000 wishes and a sick man has one. And guys, that is so true. When you lose your health, or when someone around you struggles with it, it invades every nook and cranny of your life. It affects everything. So we took her out of that system. I took her to Dallas twice, and we went to Florida a couple times, and Atlanta a dozen times. And we started piecing a lot of these therapies, a lot of them that we use with you, and the protocols that we use with you. We started putting those together to help her body heal itself. And now this was the other, last birthday party. And yes, we did have a Chuck E. Cheese birthday party. So do not shame me for my Chuck E. Cheese birthday. Every kid deserves one Chuck E. Cheese birthday party at some point in their life. And we did eat the pizza. So, but the question is, like, had she not gotten her health back, who's not in that picture? Yeah, my son. And possibly not even her. Like, who knows, right? But as she got her health back, we got her life back. And that's the thing I would implore you guys. Your health is your life. Beyond faith, family, and health, everything else is just secondary. But our health, just, it matters so much. The more of it that you have, the more life you have. And for most people, they want to get healthier because of their grandkids. They want to be able to travel. They want to go on vacations. They want to be an active grandparent. They don't want to be a rocking chair grandparent. They want to be remembered for being active and vibrant, not impaired, infirmed, and sitting in a rocking chair. So what do you do from here? So who should come and see us? Again, we're in Cool Springs, right in the heart of Middle Tennessee, right off of I-65. If you know where Whole Foods is, we're right there. If you have some of the 7 symptoms, the numbness, the burning pain, the cramping or the restless legs, the sharp stabbing, electrical pain, prickling and tingling, balance problems and falls, or issues with sleep, those are the most common reasons that people come and see us. Or if you just don't have any of those symptoms, but you want to be healthier. We're a full-service natural health center, so we have, technology, and we have blood testing. I've got a phlebotomist that works in my office. We can draw labs, and we can look at hormones, and we can look at toxicity levels and your gut health, weight loss. Like, there's tons of different options. If you want to get healthier and live that marginal decade on your terms, then you have to be healthy in order to do that. So we'd love to see if we can help you get there. So the next steps is to reserve your appointment. And when you come in, we're going to do a consultation, and you're going to meet with me. I don't pass you off to the staff. It's going to be you and me. You're stuck with me one-on-one. We're going to meet and go over all your health history, perform an evaluation, find out exactly what's going on with you, and see if you qualify for what we do. And if you do, then we're going to recommend a treatment plan. And Guys, there's no tricks, no gimmicks. We're going to do the testing, find out if you qualify, and if you do, I'm going to show you here's what you need to do about it. And if your answer is no or it's not the right time, then that is your prerogative. You're the CEO of your health, not me. My job is just to kind of help you get there. So when you come in, we do this advanced neurological exam. So a 36-point neurological exam, we have to test all those 7 nerve fibers. We have to look at blood flow, sometimes even x-rays if necessary. All the testing, head to toe, postural exam, everything to find out where your health is at, what nerves are damaged, and then what we have to do to get those back online. And the one thing we ask is bring the person closest to you. And the reason for that is twofold. Number one is that health and sickness is a family affair, not an individual affair. So we want you to bring your spouse, bring your wife, bring your husband. Especially for husbands too, I want you to bring your wife, because I'll ask the husband, like, you know, tell me how you're sleeping. And they'll say, you know, well, I sleep great. And she's like, no, you don't sleep great. You're kicking me all night long. So I want her opinion and your opinion. We want to know where everybody's at. And sometimes too, like the spouse is not even aware of how bad of the problem that you're going through, or they may think it's worse than it is. I mean, it could be either one. So we want everybody on the same page. So bring the person closest to you to that appointment, and then they can ask any questions they want as well. So if you had all that testing done in the hospital, which they don't do that, but if they did, how much do you think it would cost? You know, who knows? Thousands, tens, who knows? So our walk-in pricing is $249. So if you walk in off the street to do all that testing, spend an hour, hour and a half with you one-on-one, it's about $249. But because you're on the webinar today, we do it for $89. And the reason I discount it after the webinar is because you know exactly, basically, you know what neuropathy is, you know what can cause it, and then what treatments we use in our philosophy. So when you get in or come in, we can kind of get right down to business. So this saves me a ton of time. This setting, as making it this far, I want to congratulate you for making it this far in the webinar, but this saves me a ton of time in this format. So who should not come in for an evaluation is if you're not serious about getting better. So we want people that really truly want to get well. They want to be vibrant as they get older. They want to get their mobility and maintain their mobility. They just want to be healthier. So if you're serious about getting healthy, there's nothing me and my staff won't do to help you get there, but I can't want it more than you do. So serious about getting better. And if the $89 is a stretch, if you can schedule now, and there'll be a link below, or you can visit our office at wellnesstn.com, wellnesstn, like Tennessee, wellnesstn.com. You can schedule right on the website for the nerve screening. It's $39 because it helps kind of keep me consistent, and I can track who signs up from the webinar, and you kind of know when and how to post this. So neuropathy is progressive and degenerative, gets worse over time. That's the one thing we know. If you have neuropathy, it's progressive and degenerative. It only moves in one direction. So when is the best time to get healthy? That would be yesterday. Second best time would be today. And then the worst time to get healthy is when? You know, some other day or later, because we know that day almost never comes. When people come in, you'll see various different scans. We do the nerve testing, and it gives us a printout. It shows us exactly which nerves are damaged and by how much. Like a lot of that dark black shows all the damage, and then when you graduate the program, then you can see the post scan of kind of, you know, great, you're feeling better, but are we actually fixing the underlying problem? And you see all these varying people. I could show you literally over 150 of these, you know, success
So this
stories
is
over the
Paul.
years.
We just did his
Here's
final
a quick
exam for his neuropathy
testimonial.
care, and he's done an amazing job. These are his pre and post. This is when he first came in, so you can kind of see we do a culmination of all these tests, and it shows out a graph of bottom of the foot, top of the foot, heel, and the calf. All the areas we tested with his neuropathy made pretty massive improvement. So I just want to give him a chance to mention, you know, what have you noticed? What did you come in with, and what have you noticed since that time?
Well, I came in with a great deal of concern because I knew what the end result could be if I didn't take care of this. And so I was first very thrilled to find that there was a solution available. Most people aren't aware of that. But the symptoms I had when I came through were pain, uh, sleep interruptions, constant numbness, burning, all the symptoms that you might associate with neuropathy. And would say within, 3 weeks of treatment, I began to see a real improvement. the way I felt, the way I could sleep. And after the 2.5 months, it's day and night. I'm just thrilled I found you guys, that's all.
So glad you did. And he was religious with making his appointments, did his home care.
Yeah,
I'm
diet.
assuming you did your home care.
I did, yeah, yeah.
Sounds
Never
good.
missed. Never missed.
Did you say you lost 20 pounds?
Lost 20 pounds?
Lost 20 pounds.
Great, that's a good bonus. So healing is possible, and most people have been told there's nothing they can do about it, and just take the gabapentin and just learn to live with it. But that's not the case, and your body can heal if we put the right steps in place. So, thank you, friend.
Yeah, thank you.
All right.
Thank you.
Thank you, friend. Yeah, thank you. All right. And again, I could show you 100.
Hey guys, so this is Valerie. This is my good buddy. So she has an amazing story. She just gave us a progress report. So you just went to the doctor. Was that today? Yesterday.
Yes,
And
progress.
tell me the results.
Well, I am diabetic.
Were.
Well, I was diabetic.
Were.
Were diabetic because my A1C dropped from 8 since I've been coming here to 5.4, which takes me off the diabetic list. And it takes me off the metformin medication, which is 14 pills
Yeah, you're
a
on 14
week.
pills a week.
a week. So now I don't have to take 14 pills a week. And think of the money I'm going to save, which isn't that big of a deal, but every little bit helps. And I also lost 20 pounds
20 pounds. In how long?
since April. Since April 27th.
Is that 2 months?
Since I've been coming.
3 months.
3 months.
3 months.
Since I've been coming here.
How your feet feel?
My feet are great. I can put shoes on, sneakers on. I'm working out. I've got to my trainer. I'm feeling good. I have more energy. I don't have that poor, pitiful me feeling of being in pain. You know, not that I don't have some days that I'm human, but most of the time I'm really good. I would say 90%. And the neuropathy has pretty much disappeared. I don't have those tingles anymore. I can feel my toes for the first time in 5 years. So, yeah, I'm good.
She did it. Your body can heal. Your body's capable of healing if you just do the right work, and she has done the work.
And we still got more.
That's right.
Still more.
You're great. Thank you.
So did you catch the part of her story where she reversed her diabetes? Now most people are told that that's not even possible and that it can't be done, but we get to see that literally daily in our office. So let's say weekly in our office, where people reverse chronic disease and they get off medications because they get to the root of the problem. Your body has an incredible capacity to heal. If I cut your finger, if you ever had a paper cut, like nobody's walking around with a paper cut from the Reagan administration, like your body heals. If you sprain your ankle or if you get a cold, your body heals itself because it's designed to do that. We just have to give it what it needs to heal and repair and give it the stimulus, and then we have to remove the barriers and the obstacles and what's interfering with your health, and it's really that simple. So I'm done, guys. Click the link below. I'd love to see you in the office for an exam. Don't wait. The problem gets worse. If I can be a resource, please let us know, and have a beautiful day, and God bless.